Custom Care Medical, Dr. Frank Contessessa. Doctor, what are your observations about these new medications?
Sure, Bob. So, this is an exciting time in the treatment of Alzheimer's. So, if you've been following the news of the last couple of weeks, this is the second drug that's been talked about. So this one hasn't been approved yet, but it's being talked about. So I want to talk about the similarities first, and then I'll talk about the differences. So what makes these two similar is their mechanism of action. So the way these drugs work and the way they attack Alzheimer's is that they're targeting the amyloid proteins, which form plaques, which collect in the brains of these people. And we think that these plaques gum up the works as far as cognitive abilities and memory. So these two medications attack these. It's a monoclonal antibody, very similar to what we remember during COVID. So it targets these proteins, tells our immune system to get rid of these things, and actually can work to clear these plaques from the brain. What makes them different is that, number one, the first one that came out, Leqembi, a couple of weeks ago, is twice weekly. This new one, which is donanemab, is once monthly. The other main difference is that the first one that we talked about a few weeks ago is designed to be given for the rest of the patient's life. So it clears the plaques, but then you continue to take it. This new drug, donanemab, is given for a year to 18 months, clears the plaques, and then the patient can either stop the medicine or go on to a maintenance regimen. So it becomes more cost effective because these drugs are very, very expensive. So if you can treat somebody for, say, a year, year and a half, and you can get lasting effects, then it becomes more cost effective. And the other main difference is that this one, actually, the new one, donanemab, actually outperformed Leqembi by a little bit. So that's really exciting news.
Dr. Frank, do we know when the new donanemab might be approved? Again, I think once people hear that it even outperformed Leqembi, they're going to be very, very anxious to be able to get their hands on it and hopefully have it covered by insurance. Do we have any timelines?
They're projecting by the end of the year. So Medicare, if they decide to approve these, Leqembi is already going to be covered. So, it's extremely expensive, $26,000 a year. Donanemab, Eli Lilly has not come out with pricing yet, but we expect it's going to be similar to Leqembi in pricing.
And what about side effects?
Good question. So side effects did happen. Thankfully, they were relatively uncommon, but when they did happen, they could be severe. Side effects including swelling of the brain and bleeding into the brain, which obviously were more common in people taking blood thinners, which a lot of these patient population are. They tend to be older people, so a lot of these people are on blood thinners. So if you're on multiple blood thinners for, say, heart disease or for irregular heartbeat, like atrial fibrillation, you're not going to be able to take these medications. Thankfully, the people who got the swelling of the brain, they didn't even know that they had these symptoms. They just showed up on MRI or a CAT scan, and then they resolved as the medication was withdrawn. So, yeah, there are side effects, but they seem like the benefit is worth the risk.
Quickly before we go, Doctor, my dad suffered dementia as he was getting older. I'm kind of curious do you have a way to describe the typical declining versus how much that can be reversed by these medications? Is there some way you can describe that to people?
Well, that's a good question, Bob. And the answer is there is no reversal. These drugs do not reverse anything. And actually, in this new study with donanemab, the benefit was the greatest when the drug was started the earliest. As a matter of fact, so the 35% figure that Christina talked about earlier in the segment was across the whole population. But for people who started very early, the benefit was actually up to 60%.
Wow.
So there were people who had zero progression of the disease after a year to 18 months, which is absolutely remarkable. So there is no reversal of Alzheimer's or the dementia, but if you can stop it early, then that's just as good for people who are just coming into the disease.
That's a great explanation, and clearly saying, again, this is not a cure per se or not a reversal, but it can significantly slow that cognitive decline if caught early. So again, thanks for clarifying that. Dr. Frank, we appreciate it as always.